My name is Halima Adan. I'm the Director of Nursing Services in Machakos County. So when COVID-19 came, everybody was worried. We were not sure of what to expect, because in the news there were this tragic news that people were dying, that we needed sophisticated equipment to manage the patients, which we did not have. But somehow, we thank God, under his able leadership, that is Dr. Alfred Mutua and the CC Health, Dr. Ansent Kituku, we are currently boasting of over 200 bed capacity isolation. And the isolation facilities are spread out in the whole county. We have about 122 beds in the various health facilities. There are some facilities with 2 beds, others with 3 beds where they can hold patients, but the specific designated isolation facilities are 3. That is here at level 5, where we have the critical care 11-bed ward. We also have Kangundo, which is a level 4 hospital with about 16 beds. And there's also another facility where we are currently holding about 4 patients who are COVID positive in Machakos sub-county. That is the Kenanie isolation facility. Naturally, I think women they nurture. Like the care we give is personalized. And mostly in the nursing profession, traditionally, women took up that role since the founder of nursing, that is Florence Nightingale. And apparently this year, worldwide, nurses are celebrating the Year of the Nurse, which was dedicated by WHO as the Year of the Nurse. So based on that, in Machakos County, more than 70% of the nurses are women. And being a former union leader, I was the branch secretary for the union until I got the position in management around November. I've always seen the nurses in Machakos and also in other counties as people who are dedicated to serve and people who are not shying off from leading from the front. So, like at a glance, based on the experience and the years they have worked, most of the managers in the sub-counties, I won't be biased, we still have men, but most of them are women. And they are women, 70%. Yes, they are women who are not shy from leading the way. So when I talk of COVID and what women are doing, I would say they're doing a lot.
We've set aside one theater which is dedicated to operations for COVID positive patients. So while I'm here, we'll also, if the patients need critical care, they will also end up in this ICU. So you can see we are set, we are ready, so that all positive patients, they are operated on without any delays, and everything goes according to plan.
So our care is holistic, like we don't just take care of the physiological needs of patients. We also take care of mental needs for patients. We take care of spiritual needs for patients. We are able to assess and know just from the talk, when you're dealing with clients or when you're preparing to deal with clients, we look at it holistically. We don't just look at one side. For example, nurses are the only healthcare workers who stay with patients for over 24 hours. There is no single minute you will miss a nurse within where a patient is being taken care of. So even in leadership, when there are decisions to be made, when probably people are thinking of buildings, the nurse will come and say, yes, there are buildings, but in the building we'll need a comfortable bed, we'll need comfortable beddings. These beddings need to be cleaned regularly. The patient needs to be fed well, the nutritional aspects of the patient. So the care is holistic, and the nurses and the women in the healthcare department, because even at the leadership position, we have about 9 directors, and out of the 9, 3 are women. And I'm sure the number replicates all over to the lowest facility. So I would say there is a lot that women are doing. When we just walked in here, you found women. Not to say that there are no men, they are there, but the ratios of women and men in nursing, the women, of course, are many, but we also have very good male nurses around who are really supporting the women to ensure that we work as a team and deliver care to our patients. And as we take care of the patients within the hospitals, we are also taking care of the families and the communities out there.